Hi, I'm Bridget, and this is Linda, and we're respiratory therapists at the main campus, and we're going to be discussing oxygen devices. Okay, first up, you have your nasal cannula, basic nasal cannula, max flow, 6 liters per minute. This is also the only device you can hook up to a bubble humidifier. The only one. Nothing else gets hooked up, okay? Next up, if the nasal cannula is not cutting it and you need a higher liter flow than 6, you can switch to an Oxymizer. Has this little pendant in the middle here that acts as a reservoir and catches some of the oxygen and kind of creates a higher FiO2 content for the patient. Right here, you see this max out 10 liters per minute. Maxes out, no higher than that. If you got to go higher than 10 liters per minute, Oxymax. Next step, right here, you can flush this out at 15 liters per minute. It's really nice. What's great about this is you can wean it down. So if they are more comfortable or they're a mouth breather at night when they fall asleep and you need 2 liters versus 15, you can do that with this mask. Next up is the trach collar counterpart to the Oxymask. This is the Oxy-Trach mask. You can either hook up O2 tubing to this, just to put them on a low liter flow, to this can max out 15. Yeah, you can max this out at 15, okay? What's great about this, the trach patient needs aerosol, they need moisture, humidification. Take off this cap right here, and you hook up the corrugated tubing right here. And then that would hook up to this water bottle here. This is screwed in to the oxygen flow meter. Adjusting the flow on an aerosol trach mask does nothing to the oxygen content. It only decreases or increases your aerosol, your humidification, okay? If you want to increase or decrease FiO2, your oxygen content, little numbers right here. I don't know if you can see them, but right here. And you twist this blue, and where it lines up on that little plastic thing right there, that's your FiO2. You can go all the way up to 100%, or it can go down to 28. Okay? On to you.
Next is going to be your non-rebreather. If you find that these devices aren't working, you need to call us. They are located in our department. 15 liters. You do not wean the flow on these. You want the bag to be expanded. When the patient takes a breath, you need the bag to go at least be half full. Okay? This is only in our department. Next, we're going to talk about BiPAP masks. They have clamps on the sides of them. Please do not adjust the Velcro. When we initially put it on a patient, we set it to that patient perfectly. All you need to do is snap off the pieces to pull it off their face. And also to put it back on, you put it on them and you just snap the pieces. The next thing is going to be the Vapotherm. To change the FiO2 on the Vapotherm, you're going to push the middle blue button. It's going to start blinking the 21%. You just turn the dial to whatever FiO2 you need. You can go up to 100%. And that's all you do. You also click it to accept it. If you need to change the water, if we have another bag hanging, you're going to take off this bottom piece, you're going to twist it off and spike the bag. Now if you put the Vapotherm on standby, you're going to hold that. This is the button to turn it on and off. But make sure that once it's off, you are clamping this so water is not just continuously running through the Vapotherm.
Just remember to unclamp it whenever
you turn it back on.